Hey everyone, welcome back. I want to put a video together for you just to give you another update on how I am doing. So yesterday, Sunday, the 22nd of November was actually the first day I woke up and I did not feel nauseated. So that's a win. The symptoms are slowly starting to dissipate, but I still have a lot of chemo side effects that I'm dealing with. But the nausea right now is not one of them. And I did not go back on nausea medication after some point last week, even though my doctor wanted me to continue on. Two things I want to share with you. The first thing is, I don't know if I mentioned this in a previous video, but I did say in a previous video that one of the only things that I could drink or get down was orange juice. Now, after the second chemo treatment, that was even difficult to get down any fluid. I was probably averaging about 10 ounces a day, which is not good. But one thing I found interesting is when I went to the cancer treatment center to get my second chemo treatment, they had noticed that my vitamin D levels had increased dramatically. Back in July when I was tested, my vitamin D was at a 19, and typically you want to be at about a 50 range in terms of your vitamin D levels. And I was at a 19, so that's pretty low, but I live in the Pacific Northwest. We don't get a lot of sun throughout the year. But when they tested me 2 weeks ago, I had jumped up to a 29. And when I drink orange juice, I always get the vitamin D and calcium fortified orange juice, and I really think that had a big effect. The one drawback of orange juice is a lot of sugars in it, so if you're sugar adverse or have other medical illnesses like diabetes or whatnot, orange juice is really not the way to go. But you can cut orange juice with water. Put about a third or a half of it of water, and you can still get that orange juice taste. So I kind of started doing that a little bit, but I just wanted to share that because it's pretty dramatic. In 2014, the beginning of 2014, when I had a blood test, my vitamin D levels were at a 39. So over the course of the year, it's dropped dramatically, but chemo can do that because, as you know, I treated with chemotherapy last year in 2014. So that's the first thing. The second thing I want to share with you is I had an eye test. I went and got an eye exam last week because I've been experiencing a lot of dryness. And a lot of my videos, I don't wear glasses because normally in life I wear contacts, but I haven't been able to do that for a while because my eyes have been so dry. And so I went and had a test to make sure that my eyesight was fine and nothing was going on. Because chemotherapy affects every part of your body, including your eyes, and it can cause a lot of dryness along with other issues. And that's exactly what I was experiencing, the dryness. So I got a prescription for some drops that I should apply in my eyes about 3 to 4 times a day, and that should help with the eye dryness. I just started using the drops, so I don't know if that's the case or not. I'm okay with wearing glasses because I have to wear glasses or contacts either way. So I just kind of want to share that with you. If you're experiencing some eye dryness, it's normal, but you do want to make sure to get your eyes checked every year if you can, if you have that insurance available to you, or maybe just call an optical shop or an eye doctor and see if you can get your eyes examined. Remember, chemo affects every part of our body, so we really want to make sure that we are staying on top of our health, like I always tell you to. You hear that in a lot of my videos, you know. Being in the know, knowing your body, having that type of knowledge is always going to be the number one key in your life. Always be on top of your health. Always have your health checks, blood work. Women should be having pap smears every year. Things like that. You know, I'm an advocate for all of that. So anyway, I just want to check in and let you know that the nausea is gone. Yay. So at least that's one victory. I'm supposed to treat tomorrow round 3 of AC chemotherapy for this triple negative breast cancer. So I'll let you know how that goes when I give you another update. Take care, everyone. And stay blessed. And you know, I'm out there praying for you, and I believe in your healing. Okay? Take care. See you soon.